Thank you for joining us today for Decent Med Spotlight. Today we're here with another advertiser, Hélène Bertrand. She has two products. One is a book. It's called Low Back Pain, Three Steps to Relief in 2 Minutes. It was an Amazon bestseller, as well as the QR cream, a quick relief pain cream, natural, new, unique formula, clinically proven. Ellen, thank you so much for joining us. Introduce yourself.
I'm Dr. Hélène Bertrand. I treated people for severe chronic pain for 55 years. In the last 12 of those years, that is all I did. Doctors would send me their hopeless pain cases, and I found ways to relieve their pain because I think outside the box. And 80% of all those I treated for severe chronic pain left my practice with little or no pain at all. That is what I would like to tell the whole world now that I'm too old to practice medicine. What I did, first of all, is I invented a new way to treat low back pain because unlike all the other animals, we are vertical. All the other animals are horizontal. The weight of their body is spread over the length of their spine, but we're vertical. So the weight of our body is going not along the course of our spine, it's going down to our pelvic bones. If you put your hands on either side of your waist, you'll feel those two bones that are there to catch the weight of our body. And that weight is pushing them away from the sacrum. Those two little bones in the back is where the pelvic bones attach on the sacrum. And those two little bones are what you can use to feel in what direction the pelvic bones are displaced, if they're displaced. So that's what I explain in my new book, which I call Low Back Pain, Three Steps to Relief in 2 Minutes. And this book will tell you exactly how you can fix 90% of all low back pain. Because according to the International Association for the Study of Pain, the cause of low back pain is non-specific. That means we don't know. And that's because they don't test for the height of the pelvic bones. And the reason they don't test is that those joints, the sacroiliac joints where the pelvic bones join the sacrum, are totally irregular there. And they can't be seen with x-rays, CT scans, MRIs, or ultrasounds. They can't be seen. And because of that, the pain is non-specific. We don't know the cause. But if you feel for those pelvic bones, you will find the cause. And then in the book, I explain all kinds of ways to fix it and to prevent it. I had a lot and a lot of people come to me with severe pain, and it was everything from migraine headaches to severe arthritis to burning feet. And people were trying to use the usual treatments for that. What I decided to do instead was to inject the nerves just around the nerves that were going to the painful areas to shut up those nerves that were sending pain messages to the brain. It would take a substance called mannitol. Mannitol is used to unswell the brain or to treat glaucoma or to treat kidney failure. But every plant and every mushroom has mannitol. Why? Because mannitol is an antioxidant and it kills germs. It's a sugar molecule with one OH added to it. Since it's everywhere in nature, I thought it would be a safe thing to put around nerves. And I did. And even before the needle was out of the skin, the pain was gone. Oh, well, if the pain goes away that fast, I had a lot of doctors come and look at what I was doing. And this pharmacist came and she said, I've never seen pain go away so fast and so completely, but people don't like injections. Why don't we make it into a cream? I said, sure, let's make it into a cream. It took 16 different base creams before we found one that allowed the mannitol to penetrate through the skin and to reach the nerves. And when we found that one, I started trying it on different people. I tried it on 235 of my patients with 289 different pain conditions. The average, what I do is the pharmacist was preparing the cream in her kitchen, making these tiny little containers, 50 grams of cream. So, and she would give me the containers and I'd hand it to the patients with a questionnaire, the date, the time, how bad is your pain before you put on the cream? How bad is it after 30 minutes? How long does it take before the cream starts working? And how long does it last? Well, the average pain relief, because the pain was measured from 0 to 10, and the average pain relief was 50.8%. The average pain relief from narcotics is 36%, and the average pain relief from anti-inflammatory medications is 24%, and the average pain relief from Tylenol is 13%. So 50.8% is pretty good. Then the pharmacist and I, Marilyn Kiriazis, we decided to make it into something that we could sell. This is how we made QR cream. And QR cream, by the way, is highly, highly effective. If specialists or people who treat pain want to try it, they have access to a free tube and some instructions on how they can use it to reach the nerves that are transmitting the pain signal to the brain. These are the two products that I've put on the market since I decided to do this so that everybody could find pain relief.
So let's touch more on the QR cream. So I'm on the website at qrcream.us, and it says here that it can help up to 15 different pain types, everywhere from the headaches, the ears, the neck, the torso, the shoulder, bicep, elbow, wrist, forearm, digits, the thighs, the glutes, the back, the knee, the shin, the feet, and so much more. So, how is it that this cream can touch on such a wide array of different parts of the body when it comes to pain?
Well, because every pain message is transmitted from nerves via the nerves to reach the brain. And because of that, if you shut up the nerves, if you tell them, don't do that, the nerves quiet down. And often people with severe chronic pain will find that the more they use the cream, the longer they use the cream, the calmer the nerves get and the less pain they have. So they'll start with for instance, people who have shingles pain will have terrible pain when even area is rubbed with a shirt or a sheet or anything. As they use it more and more, the pain gets less and less and less because it calms the affected nerves. Now, how do I know that? Because I did another research project. And my patients wanted more. But of course, all I had were these little containers. I said, well, if you want more of the cream, you'll help me with my research. And they all accepted. So this is what I did for my research. I put a paper towel in their mouth, like that, a folded paper towel. And then I put a paper tape here. And then I put some capsaicin cream on either side of their upper lip. Do you know what capsaicin cream is? Well, it's hot pepper cream. So it causes burning. When the burning reached 8 out of 10, like it was burning, I removed the capsaicin cream. And on one side, I put the base cream, and on the other side, I put the base cream with mannitol. I didn't know what I was putting on. I was given a blue Q-tip for the left and a pink Q-tip for the right. And what I was putting on, the person who was getting it didn't know, and I didn't know. It was a double-blind study. And then once the two creams were put on, I asked them how much pain they had every minute for 10 minutes. On the mannitol side, the pain went whoosh, like that. And on the other side, it went like that. By 3 minutes, the probability that the two creams were the same was less than 5%. By 10 minutes, it was less than 1 in 1,000 because everybody knew what side the mannitol was on. Because on the mannitol side, they had no pain at all, and they were still having some burning on the base cream side. So I know that the mannitol shuts down the body's main pain receptor, the capsaicin receptor, which is also called TRPV1, and is the body's main pain receptor. So that's how I know that it works and that it shuts down the message that the pain nerves are sending to the brain. I've also found that it works for itch. I was doing a lot of prolotherapy, which is ways to repair ligaments and tendons and joints. And I had this woman come to me. She was referred by a doctor because she had terrible shoulder pain. When she came into the office, she had no hair on her head. All she had was psoriasis. And she was like that. She was scratching her head. And I said, but if you keep scratching your head, you're hurting the tendons that are lifting up your shoulder. You can't do that. And she said, I can't stop, doctor. I've had 15 years of itch. And I said, oh, well, why don't you try my cream? She says, I've tried everything. Nothing worked. It won't work. I said, well, try it anyway. It doesn't cost anything. So she puts it on, and 3 minutes later, her itch is gone. And when she came back, she had this much hair all over. That was a month later. She had this much hair all over her head, no psoriasis, and her shoulders weren't hurting anymore because she wasn't scratching. So I've tried it on a lot of people. It takes away the itch of poison ivy, poison oak, mosquito bites, insect stings. So I know that it not only shuts down the body's main pain receptor, but it also shuts down the itch message. That's how I know.
Thank you for sharing. And one thing I really like about what you're doing is that you're study first and science first. And just one thing to add about mannitol, and this is according to AI Overview and the National Institute of Health, mannitol is an osmotic sugar alcohol primarily used in emergency and critical care to rapidly reduce elevated intracranial pressure, lower intraocular pressure, and promote diuresis. But the reason why, to your point, why it can help with pain is by altering fluid dynamics and desensitizing specific pain receptors, especially when related to headaches, nerve-related conditions, and inflammation.
Oh my gosh, I'm so glad you found that. Because when I started studying this 14 years ago, and when I started studying this, nothing was known about whether it could help pain or itch. It was just known for unswelling the brain and unswelling the eyes and helping with kidney failure. When I started out, people didn't believe it until they came to my office and they saw what was happening. So I'm so glad now that even Google is, or AI is actually finding these effects of mannitol.
Yeah, just going back to your research available at qrcream.us/pages/clinical-evidence. According to this chart, the thumb, leg, wrist, thigh, fingers, knee, neck, arm, hip, back, foot, face, jaw, trigeminal, headache, shoulder, peripheral neuropathy, elbow, hand, ankle, and chest. All of these people ranging from a number of 34 for back pain or 41 for knee pain, as low as 5 for chest. Use of the cream was 235. Average pain relief was 53, which again, compared to its competitors, which is things like narcotics, 36% average pain relief, NSAIDs, such as Advil, Aleve, Neuroproxen, and so many other pharmaceuticals is 23, and then Tylenol at the bottom with 13%. So 53%, that's pretty good as
The thing
far
is,
as your study as well. Yes, ma'am?
the thing is that it works best where the nerves are closest to the skin surface. Well, it works beautifully on the upper back, but it doesn't work that well on the lower back because that part is underneath the gluteal muscles and a lot of fat often. And because of that, as the cream penetrates through the skin, it gets diluted by the body fluids. And the further away it is from the skin, the more diluted it is. And that's why when you're using the cream, you want to make sure that the nerves are closer to the skin surface. It works best when the nerves are closest to the skin surface, like headaches, like finger pain, like from arthritis, like knee arthritis, or pain in the feet, or peripheral neuropathy in the fingers and in the toes, because these are areas of the body where the the cream doesn't have to go that far. The mannitol doesn't have to penetrate that far to reach the nerves. That's why it works so well in those areas.
To your claim, just looking at your results, and thumb, leg, wrist, thigh, fingers, and knee all had above a 50% or all in the 60s or higher as far as average pain relief. And the headache was at 47%. I wonder if you were to do another study where it was just 100% head, I wonder how the numbers would come out if you did it just for people with headaches. Another stat I found interesting is another significant fact is that on average, pain relief started 16 minutes after the cream was applied and lasted 4 hours. 16 minutes is pretty good comparatively to, again, the alternatives like narcotics, Tylenol, and NSAIDs types of pharmaceuticals, which all take longer than 16 minutes as far as it's starting out.
Well, remember when I was injecting around nerves, before the needle was even out of the skin, as soon as the mannitol touches the nerve, it's like gone. Of course, if you're putting it on the skin, it takes a while to reach the nerves, but it takes 16, 17 minutes and it will reach those nerves. As soon as the mannitol hits the nerve, that controls the pain. That's why it works so fast.
That's a great point. And now, talking of neuropathy, that Russ said, "Hi, my name is Russ, and I've had peripheral neuropathy for the last 15 years, and it got worse and worse and worse until this year it prevented me from walking and doing things that I love in life, and was left with my left foot that was very bad. And then I came and found Dr. Bertrand, and she had the QR cream, and it worked like a charm. I've used it for about 3 months, and it seems like being in heaven because I can do things that I used to do all my life. So thank you, Dr. Bertrand. I really appreciate it." Jane, who had knee arthritis, said, "The QR cream is wonderful. I put it on. I could sing all day to work. It helps so much, especially at night when my legs were in a lot of pain. I got up and rubbed the cream in very well. The swelling went down, and I felt so comfortable that I want to continue using it. I think it's very good. My pain went from about 8 out of 10 to 2 out of 10 within the first week I've been using it. Going to bed when it was just so bad, I put it on and then I would sleep through the night. Because I wear steel-toed shoes at work, my legs would be very puffed up. Now they are not puffy. With the cream, I kept putting it on my knee, and the other night my daughter said to me, "Mom, you look so good. You don't look drained." I just told her, "Cheryl, it is the cream I'm using on my knee right now. My knee doesn't draw me out. It doesn't drain me. The pain doesn't drain me anymore. I feel I can carry on." So, how does it make you feel hearing these testimonials?
Oh, I love it. I get such a kick out of seeing people get better. I'm 83 years old now, and when I go for my walk in the woods every day, I'll meet people who are in pain, and right then and there, I can help them. And it's a wonderful feeling. Since I had this woman that I saw about a month ago, and she was limping. She was in such pain from her back. I said, "Oh well, let's look at your back." And sure enough, her pelvic bones were totally displaced. And so I gave her the 2-minute corrective exercise. She did it right then and there in front of me. And then she gets up, she tests her back, and the pain is gone. And she was so happy. She says, I haven't felt this good in years. And for me, that makes my day. That's what I want to leave for the rest of the world. I want people to know how they can relieve their own pain. That's my goal, essentially. That's my legacy. I hope that before I die, a whole lot of people will know how to relieve their own pain. For those who have low back pain, and that's 80% of all human beings will, because we're vertical animals, 80% of all human beings will have pain in their life from their lower back. Sometimes it doesn't last, sometimes it lasts forever. I had it for 37 years. Make sure you get that book if you want to get rid of your low back pain. If you want to get rid of pain in your joints or headaches, make sure you get QR cream.
Thank you so much for sharing. And just looking at a lot of your studies, I mean, this is a double blind, a second study on QR cream. 16 out of the 20 patients suffering with pain were relieved, and this was pain from shingles. And when you brought up back pain, I mean, 80% of the population, that's billions of people, are expected to have some sort of back pain without their lives. So something like this is it's a miracle, especially when utilizing mannitol, which, correct me if I'm wrong, but it's 100% natural.
You know something? I get a huge kick out of this because I see the results of what I do like all the time. And for me, it's a great source of pleasure. That's what life is all about. It has to be enjoyed. And if you have pain, you can't enjoy it. For me to give people the possibility of enjoying their lives makes me very happy.
So I have to ask, and a lot of the things on your website, I definitely will add to our website at decentmed.org/shop and in related areas corresponding to the different types of pain and conditions that you address with QR Cream. But what I have to ask is, how is it that your exercise works? Or I should say, your 3 steps to relief work? Because 120 seconds for relief is a lot faster than any chiropractic adjustment I've ever been to.
Well, it's very easy because most of that pain is due to displaced pelvic bones. And what holds those pelvic bones to the sacrum, so the sacroiliac joint, around these joints, there are more ligaments trying to hold the joint steady than any other joint in the body. And those ligaments are full of nerves that tell the brain what that joint is doing. If you close your eyes and you move your fingers, you'll know exactly what your fingers are doing. Well, those ligaments tell the brain what the sacroiliac joint is doing. And when that joint is out of place, those ligaments get overstretched. And overstretched nerves will send pain signals to the brain. That's how you know that that is the cause of the pain. The pain is telling you that those joints are out of place. And the 2-minute exercise that I tell people to do is a way for those people to learn how to replace the bones where they belong. And when the joint is in place, the ligaments trying to hold it are also no longer overstretched. And because of that, they stop complaining. That's why 90% of those with displaced pelvic joints and get up from the 2-minute exercise with no pain because the nerves are no longer being injured. They're no longer being overstretched. That's it. It's very simple.
It's interesting because I'm looking at your article, The Truth About Topical Pain Relief Creams and just other pain relievers on the market. And from what I'm noticing is that what you do is you work with the body in its ability to heal itself versus menthol, camphor, essential oils, and other creams. Typically, the way they work, and take some of the ones I just mentioned, for example, is that it works at a sensory level. So the relief comes from the heating or cooling sensation, not from working with the body's way of healing itself. Can you touch a little bit more on that?
Well, I'd love to touch a lot more on that. Uh, the thing is that the nerves are what controls how you heal yourself. And and if the nerves are irritated and not actually trying to fix a given area, but simply irritated, they'll start the inflammation process, which is the way your body starts to repair itself. And inflammation causes pain. And so a lot of anti-inflammatory treatments are helping to help inflammation, but it doesn't help the problem if the problem isn't inflammation, isn't something that needs immediate repair. If you cut yourself and it gets all red around the joint, well, that joint is going to be fixed because you've created a lot of new blood vessels thanks to inflammation to bring the repair cells where you're broken, and those repair cells will deposit collagen, scar tissue, to help repair the break. But if you don't have a break, if it's just irritated nerves, What you're doing by stopping the inflammation is not going to fix the problem. You have to fix the nerves. And that's what QR cream does.
Is that it's a nervous system problem, not a sensory problem.
Well, it is a sensory problem because it's the function of those nerves that's being reestablished, that's being fixed. Whereas
Mhm.
the nervous system, the brain, is just the receptor of all those messages. It receives the messages. That's not where you fix yourself. Where you fix yourself is where the nerve endings are that are in touch with that sore area.
And that's where the mannitol comes in.
Exactly.
Mm. And that's why something like QR cream is so impactful for headaches, for example.
Yes, but you have to know where the nerves that cause the headaches are. Like the nerves that cause the headaches, one of them, two of are here, and then here, and you can feel the little dimples in the bone. You'll feel those little no, not there. Watch. You have to feel where there are little dimples in the bone. Here, you feel the dimple here? And you have to feel the little dimples here and here. You'll feel those dimples because those are holes in the bone that go from the brain to the skin. And it's those little dimples that you have to start with. But with the eyes, it's be very careful because you sure don't want to put it on your eyelids. As if it goes into your eyes, it's going to burn. So because there's a little bit of menthol in there, and the menthol will burn your eyes. The mannitol won't, but if there's menthol in there, it'll burn your eyes. So you have to put it exactly where these holes are and then up your forehead, because that's the way those nerves travel. And if you go to my website, you'll see instructions on how to treat different parts of the body because you have to treat the nerves. I have another meeting right now, so I'm going to have to say goodbye to you. But
Yeah.
thank you for the interview. It was an interview from somebody who is very, very well organized and knowledgeable, and that's impressive.
Thank you for joining us, Dr. Bertrand. This has been our latest episode of Decent Med Spotlight, and you guys have a great one. You can buy her products, her books available on Amazon and qrcream.us or decentmed.org/shop. Thank you and
Uh,
have a great day.
your best bet is Amazon. That if you are somebody who treats people, you need to let me know, and I will give you areas where you can get this for less, and you can start selling it to other people.